In this video, we will be reviewing other eye disorders by critically thinking through 5 questions. The questions will contain subjects cataracts, macular degeneration, presbyopia, retinal detachment, myopia, which is nearsightedness, hyperopia, which is farsightedness, and a question on the Snellen chart. I will read the question for those listening, then pause to give you a second to think of your own answer. Then I will read the options and we will discuss. This is just a surface review on these topics. If you need more information, you can find that in your nursing resources, usually under the neurological and/or eye disorder chapters. Let's get started. Question number 1. A client status post lens replacement for cataracts is being discharged. What is the most important teaching for this patient? Remember, this 3-second pause is a chance for you to think of what your answer would be. Is it number 1, report eye pain or any changes of vision to your provider immediately? Number 2, make sure to use the eye drops as ordered. Number 3, try not to strain, cough, or bend over. Number 4, make sure to wear sunglasses outside because your eyes will be sensitive. The answer is number 1. Your thoughts should have been around what is the most important, dangerous, fatal teaching the patient needs that could lead to serious consequences if they don't know about it. The challenge in this question is that all the answers are correct, and so that's why it's important to understand priority, and Maslow tells us that the priority is always the physical, always the fatal, and therefore number 1 would indicate that something's very wrong, maybe bleeding, maybe infection, maybe a nerve issue, and that needs to be reported immediately. Number 2 is correct, however, this is just a task. It's not something serious like a physical symptom post-surgery. Number 3 is more preventive teaching. And then number 4, of course they should wear sunglasses when outside. However, if they don't, it wouldn't be fatal if they didn't do that. So it's always important as you're reviewing your teaching post-op to think about which teaching is most important to prevent a fatal physical issue from happening. And a quick review on cataracts, if you look at that picture there, it shows you that cataracts by definition is this idea of a foggy lens, kind of like how at night when you're driving and it's foggy out, it can be a little difficult to see, and that's one of their biggest complaints is night vision. And with that happening, it usually happens with age, maybe environmental factors. The lens itself, that foggy lens, needs to be replaced. So make sure you understand what cataracts are, the biggest symptom that they complain of, that night vision issue and the glare, and then also about that lens replacement, and as this question reviewed, some of the most important teaching you need to do with your patient after that surgery. Question number 2. A 72-year-old client with macular degeneration is in for his yearly eye check. The patient asks the nurse what he can do to improve his eyes. The nurse responds, is it number 1, I understand your vision is bad. You can take vitamin A daily to reverse the macular degeneration. Number 2, you want to know what you can do for your eyes. Unfortunately, macular degeneration is seen with aging. There's not much you can do. Number 3, if you control any high blood pressure, your eyes will get better. Or number 4, I understand your concern. You should talk to your doctor. The answer here is number 2. What do you remember about macular degeneration? Unfortunately, it is irreversible. It comes with age. If you look at the picture in the slide, you can see that this little back area where it's kind of a darker shadowed is the macula. It does start to degenerate, and their vision ends up very annoying to them. Centrally, they start seeing blurry or even shadows in black, and they only have vision peripherally, so I call it donut vision. And as a nurse, we need to therefore make sure we're approaching our patients from the side, not from the front, because they might not be able to see you. And one way this is screened for and checked is with a test called the Amsler grid. So make sure in this question that you, 1, respond therapeutically, and then 2, do we need to assess further? We don't. We know what he's asking, and therefore we can educate him on macular degeneration. Question number 3. A 45-year-old is noticing words are blurry when she reads. This has become progressively worse since her last eye exam a year ago. She has no other eye complaints. The patient is concerned and wants to know what is wrong with her eyes. How should the nurse respond? Should you, number 1, say, "I will let the doctor know about your reading problem." Number 2, "Have you noticed any redness or drainage coming from your eyes?" Number 3, "I am sorry you are experiencing this. Does anyone else in your family have this problem?" Number 4, "You may be experiencing presbyopia, which is an age-related farsightedness. You may be a candidate for reading glasses." The answer is number 4. She is describing a normal aging farsightedness that starts to happen when you get older, and this is called presbyopia. These patients might start noticing that they have to hold their book further away, or if you're in a restaurant, you have to hold the menu further away to be able to see it, because that means that their eyes are better far, and it's when they hold things near that they can't see it. So if you've ever noticed when we say somebody's farsighted, that means you can see better far. When somebody's nearsighted, that means you can see better near. So this patient is a candidate for some reading glasses. She might just be able to go to the local drugstore and grab a pair. She might not need to get a prescription. So this is something that we want to empathize with her, let her know nothing's wrong. And the reason that we can go ahead and teach her in this case and not still need to assess her is because in the question it already says that she has no other eye complaints. Because if that one sentence were not there, I would want to assess her to make sure nothing else is wrong before I just assume that is this normal aging presbyopia. So make sure that you review presbyopia and the teaching for it, and you can see in the picture that that's what the struggle is. That's actually a fortune from a fortune cookie, and you can see how blurry it might be to somebody that's starting to experience this age-related farsightedness. Question number 4. A patient comes into the emergency room stating that he sees a curtain shadow across his eyes and multiple floaters. During assessment, the patient reports no eye pain or any other symptoms. What should the nurse do? Should the nurse, number 1, check the client's blood pressure? Number 2, keep the patient NPO and notify the doctor? Number 3, place him in the urgent care side since his symptoms are not an emergency? Number 4, have him wait in the emergency room until the next available room? The thought here is number 2. We need to keep that patient NPO and notify the doctor ASAP. A curtain shadow falling across the eye and floaters is a classic sign of retinal detachment. And we also need to remember that retinal detachment is not painful, so we have to be careful to think that this is not an emergency. We need to call the doctor immediately because it is a medical emergency, and the patient needs to go to surgery, and they will have the retina reattached by a laser or cryotherapy. And so you can see in the picture at the bottom, kind of up at the top of that eye, you can see where the retina has started to detach, and there's a little space there. That's very dangerous. It can lead to blindness, and it has to be taken care of ASAP. And the whole reason we need to keep the patient NPO, why that is important, is because if they are going to surgery, we want to make sure they don't eat or drink anything, because most likely they might go under some anesthesia, and we want to be careful that they wouldn't aspirate when under the anesthesia. Question number 5. A client with nearsightedness, myopia, is getting his vision checked with the Snellen chart. With his glasses on, his vision is 20/10. The nurse interprets this reading as, is it number 1, the patient's vision is good, he needs no further intervention? Number 2, the patient's vision is worsening and he needs a referral to an optometrist for new glasses? Number 3, the patient is now experiencing farsightedness, which is hyperopia, and needs to be referred to an ophthalmologist? Number 4, the number indicates that he should return in 3 months for another vision check. The answer here is number 1. It's a good idea to make sure you understand and can interpret what the Snellen chart reading is. The client has great vision, because remember, 20/20 is good. 20/10 is even better. So when the bottom number goes down, that's better. But when that bottom number goes up and is bigger than that 20 at the top, that is when vision is worse. For example, 2200 is legally blind. So in this case, It's important to know that he should have his glasses on when he does this check, because the Snellen chart requires him to see from 20 feet away, and if he's nearsighted, remember, he can see near without glasses. He always needs his glasses on to see far. So always make sure when you do a Snellen chart that you allow them to have their contacts or glasses on for an accurate reading. So in this case, if you had a difficult time, just review again the Snellen chart interpretation and understand what that means and then what you should do about that. In this case, his vision is great, and we don't need to do anything. Remember, not every question you get on the test is a problem. I hope you enjoyed these questions going over some eye disorders. If you like content like this, please join and subscribe to our channel, and you can also find us at signstrategies.com.